everybody, I'm Kelly Harrison-Tait and I'm the Director of Stud at B&W Equine Vets in Gloucestershire. I'm going to talk to you today on what is needed for maximal breeding success for your mare. I'm one of the stud vets at Willesley and have been here since March 2014. Before that I did an internship at B&W over at Redstone, spent a bit of time in the Cardiff branch doing ambulatory work, and then did a stud season in Australia where I looked after 140 quarter horse mares with 4 quarter horse stallions. It was great fun. I was the only vet there and we bred the mares, shipped semen across Australia. I did embryo flushes and transfers and generally looked after all the horses and some of the cattle on the place. Since being at Willesley, I've completed my certificate in advanced veterinary practice in equine stud medicine and just kept developing my interests and skill set in the breeding world, particularly interested in embryo transfer and your subfertile mares and stallions, but really enjoy all aspects of breeding and stud work, including foals. So yeah, very lucky with my job and thoroughly enjoy it. So hopefully you'll learn some good things from myself and the team with these presentations. So today I'm just going to start going through the contents of the talk, and today we're going to talk about what is involved in preparing the mare for insemination. There's a wide range of people who join the course, some who I know are very experienced breeders, some who are thinking of breeding their first or second foal. So just going to run through the processes that a vet has to do to get the best success rates for pregnancies from your mare. I'm going to go through some differences between AI, which is artificial insemination, and natural covering. Also point out what makes your mare a good breeding candidate, and also what can be done to improve the chances of conception. This is by yourself, the owners, us as the vets, by choosing the right stallion to suit your mare, and also timing for seasonality and what works best. It's important that we are able to give you realistic expectations and success rates that you're expecting. Breeding is emotional and financial, and I think the more information you have about your chances of having a foal in a year's time, the better. So this is just a pull-out from our breeding brochure, which we're more than happy to send out if you are interested. And it just goes through the multi-step processes of routine insemination from beginning, where they're having their pre-breeding tests at home, to the end where they're having their heartbeat scans and possibly further scans as well. It's very important to be thorough. Most mares are straightforward and small percentage of mares are more complicated. And this is why shortcuts cannot be taken. If you take a shortcut when breeding a mare and she's not in foal, you won't know why. If you've done everything thoroughly, you should have some information to indicate at what point it's gone wrong or not to plan, and what we might be able to do to give her a better chance of conceiving on her next cycle. So pre-breeding tests. These are tests that can be done at home. They have to be done at home before they come to stud. We do pre-breeding tests for the herd health. We have a lot of horses from different demographics mixing on studs. Some horses have come from a one-horse owner, others have come from a big livery or competition yard, some have travelled the world eventing. And all of this needs to be considered. And when we're mixing strange horses together, then herd health and infectious disease control is vital. The UK are pretty vigilant at this testing, and it means that the risk of the disease and incidence of disease is low, and which is brilliant. So we need to continue these practices. So the first thing we do is a clitoral swab, which just got a video here. It's one of our recipient mares, Millie, at the clinic. But you just put in this little swab into the clitoral fossa and then the sinuses as well. And what we're just doing there, us vets, is just checking for any bacteria that can cause contagious equine metritis. This is a very infectious disease and easily spread, as you can imagine, from breeding horses. And it can really have a negative effect on fertility rates. So as you can see, the horses don't generally object to it. That swab's then just put into charcoal and sent to the laboratory. It has to be an HBLB approved laboratory for this testing to be official. And if you send it, you've got two choices. You can send it for culture, which takes 7 days, or you can send it for PCR, which means that the results will be available the next day. So culture, we try and grow bacteria and see what grows. PCR, you look for the DNA, so it's a lot quicker. So if you're getting your mare ready for stud, then be aware that it could take a week for the results. But if you are in a rush, for example, she's about to foal, just push the vet to send it for a PCR, which means you should get it the next day and you can get her into stud quicker if everything's okay. The other thing we do is take a blood sample. We blood test for EVA, which is equine viral arteritis, and we also recommend strangles. Obviously, strangles is not a breeding-related disease, it's just a well-known horse disease, and you wouldn't be very happy if your mare went to stud and came back with strangles. So by making sure everything is negative at the beginning means that that shouldn't happen. Some establishments, and certainly the thoroughbred breeding industry, also require EIA, which is infectious anemia. We've not currently got that in the UK, and the risk of that is considered to be very low. So unless the mare's been abroad or competing a lot, we generally don't require that at most of the sports horse premises. They should also be up to date for vaccinations. With the recent equine influenza outbreak, we were asking for 6-monthly vaccinations. There's currently no active known flu in the UK, so we've relaxed back to 12-month annual boosters. But they need to be up to date again to protect themselves and to protect others. Tetanus is another important vaccine that needs to be up to date for brood mares. When a broodmare foals, blood vessels are exposed to the environment, which is where tetanus lives. So they are at quite high risk of getting that if they're not up to date with the vaccine. So that is very important. So so just summary to why we want to prevent the spread of contagious disease. We've got a lot of mixing of unknown individuals, and it's protecting your horse as well as everybody else's. The next thing that we'd look at, if all those tests are clear, or if she's a good mare and you've got facilities at home, we might scan them at home, especially if they've not had a foal before, or you've not bred her before, or she's had any problems in the past. It's quite nice to have an ultrasound scan of the uterus and ovaries at home before taking her into stud to make sure that she's got 2 ovaries. Mares are ovariectomized sometimes, or for either medical reasons or behavioural reasons. So that is important to start with. Also to make sure that they haven't got any abnormalities, any signs of tumours, which are very rare in horses. Profuse cysts, which are pretty common, especially in older horses. Uterine cysts, we'll come on to that later. Or any other bits and bobs, poor conformation, or anything that might go against her chances of conceiving. So having that first scan is quite important, to have a thorough scan. And to be able to perform that, they do need to be still. They need to be, this mare here is in stocks, lovely Clydesdale mare. And most horses, even this mare was also a maiden, most horses tolerate it very well, even though we've got a hand at their bottom, and they're relatively calm. They certainly get used to it very quickly. So we have a good palpation of their uterus and ovaries and their cervix first, and then follow that up with the ultrasound scan so we can visualise it. Another thing that I've come across once or twice before is a marble. So marbles historically were implanted in uteruses to stop mares coming into season, and they almost act like a fake pregnancy. And obviously if you discover a marble in there, you don't want to start inseminating that mare, so you need to get the marble out first. So looking for anything like that might catch you by surprise, but it's important to know before we think about breeding her. So just thought I'd put up this picture of an ovary from an ultrasound scan. So that's an ovary. The black area is a follicle, and the perimeter of the ovary just sits here. So we've got more images to look through later, but I just wanted to show what can be expected if you're waiting for the vet to scan your mare for the first time. So we've gone through the first couple of points of pre-breeding tests and your initial ultrasound scan. Now it's what to do. So on the ultrasound scan, we can generally determine if they're in season or not in season. So if your mare is not in season, there are a couple of options. The first one is just to wait for them to come into season naturally. A horse's estrous cycle is usually 21 days on average. It can vary, can be 20 to 28 days. Some mares are very obvious when they're in season. They can be more vocal, they can urinate more, they can basically lift the tail heads and tease even with other mares. They can be more erratic in their behaviours, they can become more moody. Others stood there eating their hay like it's another day, so it can vary hugely, and some mare owners are brilliant at determining when their mares are in season, and some just, it's impossible. So basically we can wait for them to come into season, and like I said, if they display the obvious signs, and when they're early in season, that can be great because the owner can ring up and bring her into stud, or we can pop on out. They're more subtle with their signs. It can be a bit more tricky and just relies on frequent scanning. The other option is you can give hormonal manipulation, so you can give some prostaglandin injection into the muscle to short cycle them. Before that, it's important that we ask you to check the stallion's availability first. If she's in at the studs, usually the stud managers will do that for you. But before short cycling the mare, checking that the semen is available for the following week or whenever we think we might need it is vital. The stallion's off competing in Portugal for 2 weeks. I would recommend that you just sit and wait and see what the mare's going to do. If you do short cycle her, you have to wait for 5 days after the last ovulation. So when the ovulation happens, I'll try not to get too scientific, but a corpus luteum forms, and that corpus luteum has receptors on the outside that become more and more numerous as time passes after ovulation. So it takes about 5 days for those receptors to be really switched on to the prostaglandin. Giving it too early can sometimes have a negative effect and cause them to have ovulation problems on their next cycle. So being patient where you can is vital. They come into season about 2 to 7 days after administration of the prostaglandin, and that time frame depends on what follicle sizes they've got on their ovaries at the time of the injection. If they've got a large follicle, they're going to come into season much quicker than if they've got smaller follicles. So normally we'd scan them 2 to 3 days after injection with the prostaglandin. So now you've got a mare in season, whether she's in season on the first scan or whether we've waited or whether we've injected her into season. And we've determined that by her ultrasound scan. The next thing to do is perform an endometrial swab. This informs us if the uterine health is acceptable to inseminate. It's very easy to do. You just slide a swab through her cervix into her uterus, twiddle it around for half a minute or so, and then you've got your sample. And again, I'll try not to keep getting too scientific, but we then look at the cytology and culture of that swab. And this is what we can see. So what we've got on the left side picture is bacterial culture after 24 hours of growth. And there's some hemolytic bacteria, so that's bacteria that's eaten through this blood agar. And there's a couple of different types of colonies on here, so there's quite a lot of growth going on there. And that would have a negative impact on the conception rate for that mare. If I saw that, then I would recommend to the owner, to you guys, that we don't inseminate on this cycle, that we treat that bacterial infection and try and clean her up before we order semen. Otherwise, if you inseminate her on that cycle, there's a good chance that she will not conceive, and also a higher chance of early embryonic loss. The first 40 days of pregnancy is a higher risk for embryonic loss than afterwards, and things like endometritis will increase the chances of your mare losing the pregnancy. The picture on the right is a picture of a cytology slide. Again, what we do want is those nice round endometrial cells. They're healthy cells, they're what every mare should have, they're just normal cells of her uterus lining. What we don't want is inflammatory cells, so these globular, deep purple nuclei signify that they're neutrophils. Neutrophils are present if there's an infection, so they're doing a good job, they are cleaning up the infection, but at the same time it's very telling that there is an infection present. So although they're doing a good job, it's not good to see them, because ideally we want to have a uterus that doesn't need neutrophils. On occasion as well, you can actually visualise bacteria, and we can determine what type of bacteria they are quite often by looking at them as well, and that can guide us in our decision making and treatment choices. We can do the cytology slide on the same day as we've taken the swab, so it gives us an indication straight away on the health of the uterus of that mare. It's also important, where possible, to get these results before ordering the semen. Sometimes the mare comes into season quicker than expected, and you're swabbing her and you've got no choice but to order semen that day, otherwise she's going to ovulate before it arrives. That's not the end of the world. If she does have some bacterial growth and some inflammatory cells, you can still carry on to inseminate the mare, but she will need quite intensive treatment afterwards to try and get the uterus in the best possible health before the embryo descends into the uterus at day 5.5 to 6. So we have got a few days. This is definitely our second choice of action though, because it's still got a very high chance of that conception not happening and the semen and the process being a waste of time. So ideally we manage to swab them at least 24 hours before we need to order semen. We get the results and we can make a decision whether we're going to order the semen or not. But as a last resort, we can get the results after we've inseminated her and treat accordingly post-insemination. All in all, it's really useful information to have. Now, say you've taken the swab and there isn't any bacterial or inflammatory cells present and she's got a really clean, healthy uterus, then we just keep scanning her and we're looking for follicle size and shape to signify when she looks like she's going to ovulate. When you inseminate a mare, depends a lot on the type of semen you use. Frozen semen longevity is a lot shorter, so you need to know exactly when she's going to ovulate. Whereas fresh and chilled has usually got a 24 to 48 hour longevity at least, so you've got quite a bit more leeway. So we're looking when we're scanning them at these follicles. So you can see this one here on the top right is like a pointed pear. Mares have an ovulation fossa, and this is almost like a little door outside to exit the ovary and to enter into the oviducts at the top of the uterus. So they point towards the door and they're going to move and pop out there and release the egg through that door. So when they start pointing like that, that signifies that they are thinking about ovulating. And the same with this one as well, she's got to point to it here. So they're both nice big pre-ovulatory follicles. This here is her edema pattern of a uterus, so you can see there's different shades of grey and black, and even a bit of white, and that just shows that her uterus is slightly swollen. She's in estrus. It's a sign that estrogen's present, which is what you want when they're in season. You want that to be high and vibrant. So this mare's looking like she's ready for insemination. The other thing to check as well is her cervix. So we either palpate the cervixes to see if it feels soft and relaxed. We can also visualise them with a speculum to see if they're open and ready for inseminating. So so we look at the follicles and the ovaries, structures on the ovaries, the edema pattern of the uterus and the cervix. If all those three things are saying we're ready, then we would order and inseminate the semen. The cervix can be tricky sometimes because older maiden mares will have a tight closed fibrosed cervix, so we have to bear that in mind when assessing these things, because even she might be in season and still have quite a closed cervix because of her age. So when ordering your semen, ordering your semen, you've got fresh or chilled is what you generally need to order. And as I previously said, you want to make sure that stallion is available, number one. And also knowing the chosen stallion's likely availability before starting the process is also vital. There's some stallions that they're still eventing or show jumping or performing dressage or endurance or whatever they're doing. And they might say that they're available for stud for the month of May only, or they're available Monday, Wednesday, Friday, or we can get semen from Europe, but generally only on the Tuesday to Friday, sometimes also a Saturday. So all of these things are vital to know. Also knowing where that stallion's based is also pretty important. If your mare needs a semen on the day that we can't get the post to us, or a courier is going to cost a fortune, then knowing where it is to see if you can drive and collect it, if it's in the UK, is also very handy. The mare can be manipulated to a degree, so we certainly give ovulation agents to make sure that they do ovulate when we need them to. If you are able to order the semen, and you definitely need to have at least spoken to the stallion owner first, you can then give an ovulation agent. This makes them ovulate 36 to 48 hours later. Generally only affects the mare if they've got a follicle 35 millimetres or bigger and they've got uterine edema, which is why it's important to scan them so often to make sure that they are ready to receive the drug. If you give them the ovulation agent in the morning and then the semen arrives the next day, then you inseminate the semen and they should ovulate within sort of 12 to 18 hours after that insemination, which, as previously mentioned, for fresh and chilled semen, that should be absolutely fine because it usually has a longevity of 24 to 48 hours minimum. We always check the semen motility under the microscope. So here's some semen from a local stallion, and as you can see, that's moving well, it's zipping across the screen, and that's brilliant. So if we receive that, we'd be very happy to put that in the mare. If possible, we keep a little bit in the fridge overnight and look at it the next day. If we think the mare's going to ovulate definitely in the next 24 hours, then if the semen's still swimming after 24 hours, then the mare's got every chance of getting full. So frozen semen. Frozen semen has got massive advantages and also some disadvantages. So the massive advantage is you send your mare to stud and the semen can already be sat there, sitting in the freezer or the liquid nitrogen, waiting. It's also great because you can use stallions that are no longer with us or stallions that are anywhere in the world. We ship frozen semen from one of the stallion centres to, across the world, to Australia, New Zealand, Kenya, Europe, America. So you've got access to any stallion that's ever existed as long as they've had semen frozen, and it lasts for an indefinite amount of time. So we have a frozen semen store up at the Willesley clinic, and we just make sure it's kept at the appropriate temperature, and it's then always there ready when your mare is. It's also good if your mare's sneaking up quickly. We don't have to panic about ordering, we can just line her up and get her inseminated. So that's a massive advantages. Disadvantages, they need to be carefully timed as semen longevity is shorter. So the timing of ovulation of the mare has to be within 6 hours of insemination. So you can generally we either do 2 doses where you put it in 6 hours before and 6 hours after an ovulation or expected ovulation. So quite often we do that at 7 or 8 p.m. at night and do the second dose at 7 or 8 a.m. in the morning, and that means we're guaranteed that at least one of those doses has gone within 6 hours of ovulation. The mare's oocyte is only known to last about 6 to 8 hours, so that's why we have to do it in that frame. Another slight issue with frozen semen is dosage. So it's becoming more and more common, and it's a bit of a stud vet pet hate, for people to only give 1 straw of frozen semen. Now, 1 straw is not a dose. A dose of semen is usually about 4 to 8 straws. Ideally, if you're checking what semen is supplied when you pay for a dose, you want to ask how many motile sperm there are in the dose. For a frozen semen dose, you ideally want a minimum of 300 million swimming sperm. So it's worth checking that with the agent or the stallion owner when purchasing, so you're aware of what sort of quality product you're getting. We also try and check the semen motility under the microscope as well. If you do only have 1 straw, however, it makes it quite tricky because you've only got half a mil of fluid, and ideally you do want all of that to go in the mare because it's such a small amount, so it's a little bit harder to check. But if we've got any suspicion or concerns, then we definitely will do. So you've given the ovulation agent and inseminated the mare. The next step is ovulation. So we scan after insemination for ovulation and make sure that that's happened within 6 hours for frozen semen and within 12 to 24 hours for chilled and fresh semen. If this has happened, you've got a great chance of conception occurring as long as everything else has run smoothly. If your mare hasn't ovulated normally, we may have to repeat the semen order and insemination, or we may potentially have to use some more frozen semen. Generally with the frozen semen, if you've got 2 doses and we put in 1 dose before, we won't put the second dose in until she has ovulated, and we just keep a really close eye on her. If you've only got 1 dose, then we will inseminate that after ovulation, so we guarantee that she has ovulated before we use up the frozen semen. Frozen semen is quite often frozen because logistically for the horse it's difficult to get the semen in the UK or locally, so we do use it carefully. It can run into trouble on weekends, so if the mare hasn't ovulated and it's a Friday, then we might be struggling to get it on the weekend. So it's whether we try and order that day to get it on the Saturday, or whether we just hope she does ovulate that day and that was soon enough for the semen longevity. Can be difficult to predict as well, because mares can grow a massive follicle that doesn't actually ovulate. So we can watch it, predict it, give the ovulation agent, she just doesn't respond. And that can make things tricky, and you can follow a mare for several days when that happens. It also can be quite frustrating. Care if there's 2 dominant follicles and double ovulation, because they can have twins. Now, despite annual press releases about healthy equine twins being produced in the UK, horses' uteruses aren't designed, they're not efficient enough to carry twins. Often the foals end up small, often the mares will abort them in their last trimester of pregnancy. Sometimes one will be born, the other one will be dead, and things like this. That it can put your mare at risk because if one fetus dies within the mare, it can make her quite toxic, and it will put the other foal at risk as well. So monitoring for double ovulation and subsequently twins is a very important thing to note down. They can also sometimes have triple ovulations, so that should definitely be recorded and looked for. So this is just a normal... So this is a picture of a normal ovulation on the left. That red outline is outline the corpus luteum. You can see how it's pointing, like the dominant follicle was pointing towards the ovulation fossa. And when they first form, I suspect this one's about 12 hours old, they stay in that shape. They become paler, so more white over time, and then they just start to shrink and regress. If they don't ovulate, this is what we get. So this is a little video, and the follicle just becomes huge, usually stays more rounded and just fills with what is actually a blood clot with fibrin strands. These are very frustrating because the mare, 99% of the time, looks like it's going to do everything that it should be doing. It's growing a nice follicle, it's got edema, no fluid, she's teasing, her cervix is relaxed, etc. And then you order the semen and then she just does not ovulate, and this forms. The other problem with these anovulatory follicles is you can't do much about it. You can't do much to prevent it, and you can't do much to get rid of them. They can also hang around for longer than other structures, which can increase the time it takes for her to start cycling again and come into season again. So they're quite frustrating on lots of levels. Some mares seem to be slightly more prone to them. I found when I was in Australia and there was a drought that some of the mares started producing a lot more of these. The mares still looked really well, but the nutritional plane was decreasing because there was less grass, and that meant that their bodies were sort of saying, actually, I'm not sure if I do want a foal, if this is what's happening. So heat and feed can be a contributing factor. There's not much that we can do as humans to sort of prevent or reduce this from happening. So you've inseminated her, she's ovulated, but she might have some fluid. So uterine fluid, sorry, I'll start the slide again, Lou. So you've inseminated her and she's ovulated. And when you check her for ovulation, you see she's got some fluid. So uterine fluid can actually occur any point in the mare's cycle, and if you see it, it generally needs addressing. Post-breeding is relatively common to have some fluid. They can have a reaction to the semen. You're putting basically an irritant fluid into her uterus, and especially maiden mares with tight cervixes don't drain these out so easily. The other thing is that some mares, if they've got glandular changes or scarring or fibrosis, can have problems with their drainage as well. So their actual uterus lining isn't as efficient. And an older mare or one that has a lot of foals can have quite a pendulous uterus. So it's kind of anti-gravity to try and expel it. So there's some reasons why they might be accumulating fluid. The other one is an infection, which we've talked about already, like an endometritis, and that bacterial growth can cause sometimes quite purulent discharge and fluid within the uterus that needs removing and flushing out. So just send you this picture. So this is an ovary, it's a scan image. This is a uterus here, and this black in the middle is fluid, and this is a hell of a lot of fluid. So if I saw this at any point in the cycle, I'd be ringing you to say, I'm really sorry, she's got this fluid. It's going to be tough for her to conceive with that, but we will treat it. So we would just wash that out copiously, which I'll come on to next. But leaving it in is not an option. She will not conceive if she has that fluid. The embryo, if it descends into that soup, is not going to survive. So treatment of fluid is pretty routine for us. We lavage it out. So this is a sample from a mare here. As you can see, it looks almost like custard. That water, well, it's 0.9% saline or Hartmann solution, which is clear when it went in, and this is the fluid that drained out. So we have a problem here with this mare. Now sometimes you can swab a mare and nothing shows. You inseminate the mare and then they have some fluid, or you're washing her out, and then this sort of discharge comes out, and sometimes the semen can actually activate an endometritis which has been sat there dormant for possibly years. What we tend to do, especially in that case if we hadn't detected anything previously, is send this fluid off to be cultured to see what grows and what type of bacteria it is, so we can treat it correctly. But we will do daily washes with however many litres in and out that it takes until it runs fairly clear, for up to 3 to 4 days after ovulation. From that point onwards, however, the embryo is thinking about descending into the uterus, so if she's got any chance of conceiving, we need to stop so that the cervix can close and so that we're not flushing the embryo out. Oxytocin is a drug that we can give into the muscle or into the vein, and that causes the uterus to contract and so helps it to expel fluid. Antibiotics are important, especially if it looks like this custard. It signifies that there's neutrophils and so an infection. And you can use antibiotics in the uterus, so after the lavage you might infuse some antibiotics into the uterus lining directly at the cause. You can also give them it systemically, so we might ask you to give them quite often triamodiazine, which is the general white sachet of antibiotics, has great penetration across the uterus. And we can actually means that we can give them a longer course, whilst, as said previously, we can only treat intrauterine for sort of 3 to 4 days after insemination. If their cervix is tight, and that's why we think they're holding fluid, so in older mares and maiden mares, you can use a cervical relaxant and you can digitally massage it, encourage them to relax to allow that fluid to drain. That's quite important, and also in these mares, us lavaging them daily is also very important because they're not going to be able to do it naturally. If it's a persistent infection, you can use a mucolytic or a kerosene. So a mucolytic is something that breaks down basically pus. So anything that's sticky and coating the sides of the uterus isn't going to come out necessarily with just lavaging. So infusing a mucolytic will break down that sticky mucus and mean that it will be dislodged when you lavage. So that's quite a handy technique to use. So she's been inseminated and ovulated, she had no fluid, or we've treated the fluid. So the next stage is her pregnancy scan, exciting bit. No one's ever as excited about seeing a pregnancy as a stud vet, let me tell you, and it still makes us very happy and when we see that conceptus in the uterus. So it's one of our favourite pieces of stud medicine. So we generally do her pregnancy scan at 14 days post-ovulation. This is when the conceptus is about 1.5 to 2.5 centimetres in diameter. It's still able to move freely around the uterus, so for the first 20 days the embryo moves around the uterus and it tells the mother, I'm here, don't get rid of me, don't come into season, look after me. And it's important to scan them at this time because whilst they are still mobile, it makes it a lot easier to crush a twin or a triplet. It also means that if they are not in foal, then we're aware of that and we can make preparations to consider inseminating her again, ordering semen, let the stallion owner know, check availability of the stallion, etc. Make a logistical plan. If you do it earlier than 14 days, you can, miss the pregnancy. You can sometimes visualise them from 11-12 days, but they're very small, sort of 0.5 centimetre or smaller, and it's quite easy to miss them or think that something that isn't a pregnancy could be. So 14 days is our recommended time. At 14 days, it's a 14-day scan here. You can see the ovary, then we come down the uterus here. That's a pregnancy. And then going up the other horn, that's actually another pregnancy. So there's twins in that pregnancy. I'll just play it again. And basically at this stage, the pregnancy is simply a black fluid-filled sphere. And that's all it is. You can't see the actual embryo, and it can be confused with an endometrial cyst as well. So having a cyst map of your mare before you inseminate her is vital, because you could be thinking she's pregnant when actually it's just a cyst out there. And the spherical cysts do occur and they look like pregnancies, so making sure you know where these are, if they've got any, is vital before starting. Okay, so you've got a lecture on stallions later on. Just going to start the slide again. Okay, so you've got a lecture on stallions later on, but I just thought I'd show you a video of a natural artificial insemination collection from a stallion, just in case anybody hasn't seen that before. This picture on the right is a natural cover, and what you want for natural cover is a good surface underfoot, protective clothing for people handling the horses, adequate restraint, so a twitch, and maybe hobbles behind so that the mare doesn't kick the stallion and protects herself and him. And you just want a nice environment, relaxed environment for them to be in. The mare's in season, so they do usually stand quite well, and that is a natural event for her. And the stallion is also usually keen to get the job done. And that's that. Now, an artificial insemination collection, what you've got here is the teaser mare in the box. That's an in-season mare. And that gives the stallion something to focus on. Got the dummy here. The stallion mounts the dummy, and then this here is an artificial vagina that I'm just feeding him into, and then he sees a teaser mare and uses the artificial vagina and ejaculates into that. And there's in this blue thing there's a collection pot which the semen drains through a filter into. And then that's the semen that we use. It's actually in Texas at the A&M University, so this is a quarter horse, and he was a university stallion, so he was a well-mannered horse that knew what he was doing. Most stallions do catch on to it pretty quickly, but they do need dummy training before we get started. But then the majority of stallions are very happy to perform this task. So some pros and cons of AI versus natural cover. Artificial insemination, there's little difference if you're using fresh semen or natural cover from a fertility perspective. So if you're using fresh semen, usually that's a collection and then inside the mare within an hour. So whether that's driving it down the 20 minutes down the road or whether you're collecting on site and putting it straight in the mare, who's also on site. So there's little difference in that. Artificial insemination can, however, allow semen to be processed if the stallion's fertility is suboptimal. So if the stallion is struggling to get mares in foal, it might be good to, well, it would definitely be advised to look at a semen sample to check its quality. And also it means that we can process it, so we can centrifuge it and remove any gel and bad things in the semen, dead sperm, etc. And also we can use semen extenders with it. This can increase the longevity of some stallions, and it also means that we can ship it across Europe. The other advantage for AI is the mare doesn't need to travel. So if a stallion's standing at stud, the mare often goes to the stallion for natural cover. So there's lots of mares going to one stallion. If the stallion's standing for AI, then he can stay at home, collect the semen, and like I said, drive the semen or post the semen across the country. So it's quite nice because a mare can just stay at home in a home environment. She's got a foal at foot, you don't have to travel her and her foal, and it can be done at the place that you want it to be done. You can also concentrate the dose to enable a low volume to be inseminated. The mare is prone to fluids. If you're picking in a massive volume of semen, some stallions can give 200 millilitres of semen when ejaculating, and lots of gel as well. Now, if you've got a mare that's prone to fluid retention, it'd be much better to put in a nice 20 ml dose, so a 10% volume of that. It's going to cause a lot less irritation and just generally be a lower fluid volume to start off with. So that's another reason to use AI. Negatives are you can sometimes only have part of a dose, so it's important to check the quality of semen as much as you can before or after inseminating it. Make sure it's alive, and assess how many sperm you've got. Extenders that are used when shipping chilled semen can cause irritation to the mare, can cause an inflammatory response, again, which is not desired. And the other thing is when ordering semen from the EU, There can be problems at border control. There was a mare last year and the semen just kept getting stuck in Germany every time I ordered it. So very frustrating, because then by the time it arrived, the mare had ovulated because it was 24 hours late. And that's a problem, because a lot of work and effort's gone into lining that mare up to be correct. It did eventually turn up one day on time and she did take in foal, but it's just a bit annoying. It could have happened a couple of months earlier. Natural semen, so obviously the stallion jumps on the mare. I suppose that can also be a negative if the mare's got an injury, or is takes particular dislike to that process. But positives are the semen is obviously fresh and there's no semen extender, which can cause irritation. We've got no knowledge of the semen quality if it's natural cover. The mare goes and gets covered and she comes back and it is what it is. So she's not in foal in 2 weeks. We don't really know if that's a mare problem or a fertility problem with the stallion. So that can be quite frustrating. You do get a whole dose because it's all gone in. Although some stallions that are very busy might have more than one covering in a day, and that can mean that his semen reserves are depleted. And although you get a full dose, which should be fine, it can be lower than you might still like. A busy stallion, however, will have less availability. You can split an ejaculate when collecting for AI several ways. You know, you can collect 6 to 8 mares worth sometimes from one ejaculate and ship that across the country. If you're just doing natural cover, that whole ejaculate's gone inside to one mare. So if he's a busy stallion, he's not going to be as available as if he was doing artificial insemination, where that one ejaculate can be split between several mares. And also there's an increased risk of injury to the mare and the stallion. So moving on to the girls, things that you need to consider for your mare are age, parity, which is the number of foals she's had, body condition, her management, health issues, conformation and seasonality. So age, this is my lovely grandmother who's 95, and sometimes we get phoned up about mares that are the equivalent of 95 or almost that old in horse years. Now, we are happy to look at basically any mare and are happy to try and assess her and try and get her in foal. But you have to be realistic with your expectations. A mare's uterine health declines from 6 years. And from 12 years and over, they're considered aged from a breeding perspective of a maiden. So it's certainly not old for a horse, but it is becoming old for breeding. Now, if they've had foals regularly, then they're much more likely to conceive and have a successful pregnancy when older. But if it's their first time and you know you definitely want to breed from this mare at some point, it is worth trying to have a youngish foal, just so that her cervix relaxes, her uterus is used and functioning, and then you can always return to breeding at a slightly later age. The other thing you can consider, if you want to keep your younger mare in work all the time and not give her 18 months off, is embryo transfer. At least then you will know that she is ovulating and can conceive, and you've got a foal in the bank. Older horses as well are more prone to that early embryonic loss, which is your first 40 days of pregnancy. So generally when we're doing pregnancy scans, we do 14-day scans, 28-day scans for the heartbeat. And then it is worth, especially in the older mare, having a 40-day scan, because then you know she's still in foal after that initial 40 days. So parity. Multiparous mares are often more likely to be able to sustain a pregnancy than the older maiden. This is due to uterine function, so the uterus has been active, the glands have been used, it's stretched, its blood supply is efficient, and basically they're just a bit more switched on to carrying a foal. An exception is if foaling trauma has previously occurred, if they've had to have a cesarean or a fetotomy or anything serious such as that in previous foalings, then they're going to have a negative impact on the mare's fertility. You can, however, consider embryo transfer or other assisted reproduction techniques such as oocyte pickup, which is harvesting eggs from the ovary. So there are ways that we can still get a live foal from your mare. Body condition score, so feeding of your mare is important. You want them basically just a normal weight. You don't want them fat and you don't want them thin. An increasing nutritional plane is usually best for fertility, which is kind of what happens in the wild. So they come out of winter into spring, grass is growing, and that's when they start cycling. And they're often going from being a bit poor because they've just wintered out on the moors or wherever they're living in the wild, and starting to gain some weight, and there's food available. So you don't need any more food when they're trying to conceive. Management is another important consideration. Stress is a factor. Cortisol levels can affect hormone production, so keeping stress to a minimum is vital. Exercise as well. Between insemination and 14-day pregnancy scan, it's important to keep workload to a minimum, as heat can affect conception and implantation. So having them very hot because they're out doing cross country is not good for the conception. So what you really want is Betty here at the top. When she came to stud, she just hung out in the field instead of doing her usual brilliant cross-country rounds, which is what her favourite thing to do is. So, you know, she then conceived and went on to have a healthy foal. And it's important to keep a consistent routine. Again, you don't want to start separating them from field mates or moving premises if they're likely to be stressed by it, because that can cause them to abort. Concurrent health issues are another negative factor to fertility. Laminitis, Cushing's, any chronic pain and chronic disease can all have a negative factor. And also you've got to consider the welfare applications of putting a mare with chronic laminitis in foal and carrying that extra weight and burden with her. I've seen a mare that developed laminitis during pregnancy, and it ended up very sadly because the mare couldn't, she did manage to give birth at full term, but she never quite recovered from the laminitis. So she did start off with it as a very healthy mare, which is a very unfortunate thing that happened. And sadly we had to foster the foal onto another mare, which did very well. But it's important to certainly not start the process with a mare that's got laminitis, and certainly not with this degree of remodelling in the x-ray at the top. Cushing's will affect fertility. I've just previously mentioned that cortisol caused by stress will affect the hormone production, and Cushing's will also produce cortisol, so that has an effect on hormone production as well. You can control Cushing's with Presen tablets, which is pergolide, and once it's under control, then fertility is very good again. If you do have a mare on Cushing's tablets, it's important that you stop this 2 to 4 weeks before foaling to allow milk letdown, as the Cushing's tablets will suppress milk production. So just a little side note there. Conformation of your mare, so talking reproductive conformation. Obviously, conformational traits generally will be passed on to the foal, or can be passed on to the foal. So if you have a mare that's got a strong conformational defect, then consider that before breeding. But from a reproductive tract point of view, the first thing you look at is her vulva, which is this area here. You can see on this mare, she's actually been stitched here and it's healed over. This will be because her vulva seal is not very tight, so she can suck in air, pool urine, or fecal material could enter into the vagina, which then when the cervix is relaxed and open can get sucked into the uterus and cause an infection. So stitching that up is quite a straightforward surgery to do. That can just be done under standing in the stocks and local anaesthetic, and can massively increase pregnancy rates on mares that you're struggling to get to conceive. The urethra as well, so pooling urine can be because the urethra is not long enough, or because previous foalings it's caused it to sink downwards with gravity. To fix that, you can do a urethral extension, which is again a standing surgery where the mucosa of the urethra is just extended. This just means that she's going to urinate closer to her vulval exit. A pendulous uterus is another factor where older mares who have had a lot of foals, the uterus just goes over the pelvic brim and it's quite tricky for fluid to be emitted because gravity pulls it all down. So this is usually a problem with the older mares that have had a lot of foals. There is a surgery that can be done to lift that uterus up to make it a better prospect. But yeah, it can cause difficulties if a mare has pendulous uteruses from a conception point of view. Cervix as well, if a mare's had a foal before, they could have had a tear from a traumatic foaling. This means that the cervical seal isn't tight, so the embryo can be emitted and infection can also get in. But you can still consider embryo transfer or ovum pickup for these mares, so you can still get an embryo from the mare, but it's just ill-advised for them to carry it themselves. So they're going to be at more risk of things such as placentitis and abortion. So season, it'd be lovely really if we could breed the mares in winter when the competition season generally is quieter and everyone's got a bit less on their plate. But 85% of mares only cycle when there is a maximum of 8 hours of darkness, which means that's spring and summer, so early April to September. You need to consider what also when you would like a foal on the ground. So gestation, so pregnancy length of a mare is around 11 months. If you're breeding a mare in that case at the beginning of April, the end of March, you're going to get an end of February, beginning of March foal. And that can be quite a harsh environment for a foal to be born into. So unless you've got big mare and foal foaling boxes and able to put them in a sensible turnout pen or paddock so that the foal can get some exercise at the same time, only for a couple of hours, and if the weather's bad, they don't go out, maybe there's an indoor pen or something like that. You need to really consider these things. And the other end of the season is having an August-September foal. The grass isn't as prevalent, so the mare won't have so much access to natural nutrition, which can affect her milk production and her condition score. And it can also mean that weaning on the other end, usually we wean sort of 4, 5, 6, 7 months old. So if it's born in September, you're looking at potentially a January weaning, which is quite a harsh time of year again to do it. So just consider those points when choosing when to breed the mare. You can manipulate mares with light. So the thoroughbred season, generally they start covering from February the 14th. And most mares go under lights just before Christmas, and that gives them, usually it's about 60 days of lights before they start ovulating. So it means that we're ready to get going in February. We can also give them hormonal control as well. And this can encourage follicular growth, but it isn't as foolproof as just light and natural seasons. The other thing as well is if you have got a competition mare and you want an embryo from her, but you want her to be competing until September, October, but you don't want a September type foal, what you can do is compete her all summer, have an embryo flush at the end of the year, freeze the embryo through the winter, and we can transfer that the following spring. So then the spring after, you will get a foal at the time that you want, whilst not disrupting your mare's competition season. So freezing of embryos is another useful technique for this reason. So in summary, for the mare, younger mares have a better chance. If they've previously foaled with a normal foaling, they are more likely to conceive. A healthy body condition score, stress-free management, no concurrent health issues, and good reproductive conformation with regular cycles with normal ovulations are what we're looking for your ideal breeding candidate. We're very used to mares where all of these boxes don't get ticked, and we're very happy to help and and tackle any sort of subfertile mare. But it's always advisable, if you've got any of these concerns for your mare, to have a good discussion with the vet first. So how might we improve your mare's chances of conception if she has got any of these problems? Well, certainly if there's a mare that we know has been covered or seen the stallion a few times of previous season, we will advise that she has a bit of a barren mare investigation. This is where we generally start by taking uterine biopsy to look at the endometrium health. These are just slides, I know they're a bit tricky, but of a normal uterus, and these are all the glands here with a nice stromal layer here. This is a subfertile uterus where it's just scar tissue and fibrosis here with no glandular pattern or barely any glandular pattern, and these glands are all filled with horrible mucus. So this mare here, you would receive the biopsy and go, okay, this looks okay, yep, she's still got a chance of getting foal, let's look a bit deeper. This one here, you'll be phoning up and say it's got a very poor chance of conceiving. So I'd probably advise that you stop there or consider ovum pickup to harvest eggs or something different instead. We also swab the biopsy. Some bacteria don't live in the top layer here, they live in the deeper layers, and by swabbing the biopsy, you're able to sample these deeper bacteria. So that's definitely a good place to start. If that draws up with nothing and you still want to investigate further, we can do a hysteroscopy. So that's an endoscopy where we visualise the uterus by putting a scope through her cervix, inflating her uterus, and we're able to have a good look around, looking for any abnormalities. We can take deeper biopsies and we can take little fluid samples of specific areas of interest. It allows you to visualise any adhesions or tumours and just basically gives you another perspective of the mare's uterine health. It also lets you get right to the tip of the oviducts as well, so you can have a look at the papillae which join the oviducts to the uterus, which can also be useful from an ovulation point of view. With the scope, you can also laser any cysts. So if there's a lot of endometrial cysts, so this at the bottom is a huge endometrial cyst, and that will be blocking the passage of the embryo and the passage of the semen. So what we do with that is pass the scope through, and with a laser we just puncture all of the cysts, so all the cysts drain, and it removes this obstruction that they cause. It's mechanical obstruction. They can reform, so choosing the time of year to do that is advisable. So if you have got a cyst and you want them treated, then doing them at the beginning of the following year it is advised rather than at the end of the previous year. Ideally, however, you do want to do it about a month before you want to start breeding her, to give the uterus some time to recover. Mare's uteruses don't have pain receptors, so it doesn't really cause the mare any discomfort. Oviductal issues as well, they're quite uncommon in mares, but old oocytes or embryos can be stuck in the oviducts and block the passage of sperm or the embryo. So it should be, if everything looks normal on biopsy and on a scope, then the oviducts would definitely be the next time to go. You can either treat this by putting some gel at the base of her oviducts internally, so passing this through the cervix and putting it at the base of the horns that way, as you would with an AI sort of situation. Or you can do it laparoscopically, where you make a small incision in the mare's flank and you directly put the gel on the outside of the oviducts, and this causes them to contract and pass out any debris or anything that's stuck inside, and expel it and clear it. The laparoscopic treatment is more effective because it's directly onto it, but it is definitely more invasive. So I'd always recommend that you try the intrauterine treatment first and then consider the laparoscopic treatment as a last result. Stallion choice as well. Some mares and stallions don't necessarily click. It's very unusual, but even a fertile stallion and fertile mare, they can have a bit of a mismatch. So consider changing the stallion. Speak to the stallion and see how that stallion's fertility is, and try and get an idea on what's going on. If you've used frozen semen, it'd be advisable to use fresh or chilled. And if you've used chilled, it's advisable to try fresh and just try and get your mare in foal with the best semen that you can access. Availability of stallion can be frustrating if repeatedly stuck in customs, And if ovulation pattern is difficult to predict, using a local stallion has huge benefits if you can drive and pick up semen that day. So considering these things will definitely help with your success rates. So owners, be patient. It can be frustrating. Mares can sometimes stop reading the textbooks and go off for a little bit of a party without the vet. And if the mare isn't on track, then don't inseminate. Don't pressure the situation, because it often is a waste of time and money to respond like that. So just listen to what your mare's doing and act accordingly. And sometimes we do have to change our plan. Finances is another thing that is important to be aware of before starting. Be realistic about the costs. Consider the chances that things will not go smoothly. Keeping the mare in foal until riding age is another consideration. You've got to get the mare in foal, pay the stud fee, foal down the mare, and then keep a horse until it's 3 or 4 years old before it can be broken in. So that expense, including with the mare, and keeping the mare while she's got a foal at foot, shouldn't be written off. If you're breeding for commercial reasons, know an approximate value of the young stock you are producing, and be realistic about costs and value of your young stock. Communicate with your vet. Keep them up to date with your budget. Make sure that you both know where you stand. It might be a let's give it one go and that's it, or it might be do whatever you can, I just really want to foal. So we get a wide variation of requests which we can tailor to your needs. The stallion fee and contracts as well. Some stallions are no foal, no fee. Some stallions are pay per cover, pay per straw. So just knowing that is another important factor when choosing your stallion if financial restraints are a consideration. Looking after your mare is important as well, so preventative medicine, so keep her feet trimmed, her vaccines up to date, and her worming programme. Also think about her teeth, don't forget those. She needs to be able to get maximal nutrition from her food. Ensure she is free of pain and stress, and an optimum body condition score before starting wherever possible. Listen to stallion owners and vets. They want your mare to be in foal almost, I'll say, as much as you do, but sometimes more. I'd even be personal about saying. So do listen to us and discuss things with us, discuss concerns and ask questions, and we'll advise you as best we possibly can. So this is a little picture of an embryo, just in case you're wondering what this picture is, but vets use a practice which has good interest and knowledge on equine reproduction. Easy mares are easy, difficult mares aren't. And if your mare ends up being a difficult mare, then it is important that she's in the right place and being looked at by the right person to maximise your chances of getting a foal. Keep up good communication, ensure the vet keeps in touch, ensure you're up to date with costs. Don't be afraid to ever ask for those, you can get them at any time. Consider advanced reproduction techniques. If conventional insemination is not working, consider your embryo transfer, your oocyte collection for your mare. Sending your mare to stud to get in foal often ensures she receives premium care. The vets into the same stud, same vets in the same stud every single day through the breeding season. And that consistency and continuity and easily accessible mare maximises the care that she's going to get. So sending them into a reproductive centre, definitely advisable over doing one mare at home. If things aren't going well and your mare is a wet stud, just ensure you speak to the vet. Find out why they're not going well. It's absolutely fine to ask why they're not in foal. What's the problem? Why aren't they cycling? We don't mind. We completely understand why you might be thinking that. So we'd much rather have that discussion with you than you be left a bit confused at home. In summary, mare owner must work as a team with the vet, stud manager and stallion owner. It's a joint effort with these things, and if we all need to be on the same page and working towards the same goal. Having realistic expectations makes everything a bit more pleasant, and means that hopefully you won't be disappointed. If you aren't having success with your mare, investigate and be prepared to alter the original plan. As I said, it is possible to get a foal from even the poorest fertility mare, but it's just a bit of patience and a bit of time and consideration is required to achieve this. This here is just a 1st of October scan in a thoroughbred, and you can just see its heart beating, its rib cage and its front legs, so I just quite like this scan. And finally, any questions, please feel free to email or telephone directly. We're all very happy to discuss this. We're all very passionate about breeding and are very happy to be consulted at any point. Thank you very much.